Good morning and welcome to our second annual Health Equity Conference. We've titled it this year, Meeting the Patients Where They Are, Physically, Emotionally, and Mentally. And we'll have three speakers who will provide some background and helpful information to address these three areas of providing patient care.
So you've got 25% increase in anxiety and depression worldwide, and a 13% increase in either starting or increasing substance use after COVID. And then you see that reflected here in this data of kind of the reversal of the main priorities. Okay.
Points in time, but the left side is low-income people, the right side is high-income people. You're much more likely to have untreated disease if you're low income. And the CDC is a good job of laying out many other disparities in oral health outcomes, which are true across the general health spectrum as well, in terms of disparities based on racial and ethnic characteristics, in terms of geography, in terms of all kinds of other things. So for dental care, we can conclude we have a dental care system, and I think maybe even a healthcare system, we could say, that primarily serves the wealthiest and healthiest segments of the population. The people most likely to interact with our healthcare systems are the most wealthy people in the country. So I'm proposing here a vision for what we could do differently.
Third one was, what was the impact? A lot of times for us as individuals, we may say something, but it may be interpreted another way. So it begs the question, are we intentional? Are we responsible for what we say or how it affects other individuals? In the healthcare field, our biggest thing is to do no harm to individuals. So if someone comes and expresses how something that we've said or something that we've done has impacted them, our first response shouldn't be defensive. It should be to understand. It's a lack of understanding. A lot of microaggressions are birthed through lack of understanding, lack of communication.
So diagnosis versus medical necessity is really important to look at. So diagnosis of a substance use disorder comes from the DSM-5. Where really looking at medical necessity is specified in ASAM. So the reason these are two different things is because people can have a substance use disorder, but their level of care is specified based on what is needed and what we come up with based on the ASAM criteria. And the one pill can kill. We're finding that people are being poisoned, and we're calling it poisoning instead of overdose because they are taking things that they were not aware was in the drug. So